I'm coming on here because I want to share a personal journey with y'all. In case you don't know, Dr. Simpson, board certified OBGYN, sex counselor. Usually my content revolves around sexuality education, vulvar and vaginal health, STIs, that kind of thing. But today is kind of a personal journey. I've never recorded content like this, so like long form content. I normally do like Instagram reels and things like that. So I am trying some new things. And so give me a little bit of grace. This is a new setup for me. I've never done anything like this before. And if I sound kind of quiet, it's because my two children are sleeping upstairs. I have a pretty strong family history of breast cancer. I have a number of aunts that have had breast cancer both pre-menopause and post-menopausally. And I've known that for a while, and I have been on increased breast cancer surveillance since I was in my early 30s, which means I'm doing mammograms and MRIs and just kind of checking on my breast health overall. But for a long time, I've thought about ways to minimize my overall risk of breast cancer. As a women's health expert, I see breast cancer, I've diagnosed breast cancer, I follow women after they've been treated for their breast cancer. So I know quite a bit about it. Cancer in general sucks. And so I've spent a lot of time thinking about what my risk of cancer and what things would be like if I ever received that horrible diagnosis. There are many options when it comes to women who have a genetic predisposition for breast cancer. They can either do increased surveillance like I've been doing for the last several years, or there is something called prophylactic treatment or surgery. And for a long time, I was okay with increased surveillance. And when I gave birth to my kids, I realized, like a lot of moms do, how important it is for us to not only take good care of ourselves, but make sure that we're around for our littles as they grow up. And while I had thought about prophylactic surgery in the past, it really started to become more something more I was considering in the last couple of years since I had my kids. But I don't know a whole lot about prophylactic surgery because I, as an OBGYN, don't do those surgeries. General surgeons are the ones, or breast cancer surgeons are the ones that do these types of surgeries. I see women afterwards and help to follow them afterwards, but I don't see them during the surgery process. So I went online looking for women who are considering this journey, prophylactic surgery for reduction of cancer risk. I went looking and looking and looking for not only women who've been through this process, but women who looked like me. Women of color who don't have cancer, but are going through prophylactic surgery to help minimize their risk. I wanted to see their experience, their pre-op care, their post-op care, tips and tricks for recovery. I mean, just kind of any information I could get. And what I realized is there are not a lot of Black and brown women that are sharing their journey. I imagine there are Black and brown women that are going through this process, but not a lot that are sharing their journey, which for someone like me, when I am looking, like a lot of us are looking for information, it was really hard because while I appreciate everyone's journey and I appreciate learning from all cultures and ethnicities, there's something about learning from someone who looks like you and are doing it for the same reasons that you are. I spent a lot of time talking to my family and my own doctors and people that I cared about kind of this journey I was considering, and I made the decision that I wanted to proceed with prophylactic surgery. And so what that means is I would be proceeding with a prophylactic mastectomy, meaning removal of the breasts and the breast tissue, with reconstruction, meaning reconstructing the breasts. And that's kind of scary. Like, it's kind of scary. And trust me, I took a lot of time thinking about this. As a physician, I go over the own risks and benefits in my head. I have several doctors that I've talked this over with, and we've all kind of come to a decision together that this is the best option for me, given my family history, my genetic risk, and taking into account that I have little people that I want to be around for a very long time. So I've decided to embark on this journey, and I've decided to take you all with me because there isn't a lot of us that are sharing this journey. And while I'm a little bit fearful of, or not fearful, I should say, but I guess a little apprehensive or hesitant, because it's my own personal journey. It's gonna be my own personal thoughts, my own personal recovery, and that's kind of scary to share with people on the internet. I remember, and I still think about me searching for that information, trying to get either validation in my choice, or just information so that I could prepare myself, not only from what my doctors are telling me and what my surgeons are telling me, but also from true lived experience from another Black or brown woman. And so I am bringing you all with me. Again, I've never done anything like this before, but my plan is I'm going to take you along with me. I will take you to doctor's appointments, although I am going to tell you I will not be recording my doctors. I will share with you the conversations that we have after my appointments are over, but I'm not going to actually share the actual doctor's appointment. I will share what it looks like before I go into surgery. I will share me after surgery, and then I'm going to show you my recovery and what that's like, in, out, good, bad, ugly. I'm going to show it to you because I really do think it's important for those who are potentially considering this journey and want to know kind of what it looks like from real life experience. And because this is the information I was looking for when I started thinking about doing this. This is what I wanted to see. This is what I needed, really, to help me make a decision, and there just wasn't a lot out there. So I'm hopeful that this journey will be educational for you. It'll give you a little bit more insight into my life and kind of the things that I'm doing. But I thought that as my first long format video, whatever that means, that this might be a great way to start. I hope you're ready. I think I am. I hope I am. I am. But come along with me and let's go for a ride.